Please join me as we listen to diagnostic value of cerebrospinal fluid in epileptic cats with unremarkable brain MRI or hippocampal signal changes only. I will have my comments at the end of the video.
Diagnostic value of cerebrospinal fluid analysis in epileptic cats with unremarkable brain MRI or hippocampal signal changes only. Abstract. Objective cerebrospinal fluid analysis is used in the diagnostic investigation of cats with epileptic seizures. The aim of this retrospective study was to evaluate the diagnostic value of CSF analysis in cats with epileptic seizures that have unremarkable brain MRI or only hippocampal signal changes. Methods: unremarkable brain MRI or MRI studies with signal alterations in the hippocampus only in cats with suspected epilepsy, and CFS analysis performed at the Small Animal Internal Department or Diagnostic Imaging Department of Vet Meduni, Vienna, Austria, between 2011 and 2017 were reviewed. Total nucleated cell count, total protein, blood contamination and cytology data from CSF analysis were evaluated. Results: in total, 87 cats were included. 70 cats had unremarkable MRI, 5 had hippocampal signal changes with contrast enhancement and 12 had hippocampal signal changes without contrast enhancement. Overall, 4 cats had abnormalities on CSF analysis, all had an increased total nucleated cell count, and no cat had increased total protein, although in 1 cat total protein was not evaluated. 3 of these cats had unremarkable MRI and 1 had hippocampal signal changes without contrast enhancement. The median duration of epileptic signs prior to the MRI study was 2 days. Conclusions and relevance: our results show that, in our cohort of epileptic cats with unremarkable brain MRI or with hippocampal signal changes, CSF analysis was usually normal. This should be considered before performing a CSF tap. Introduction. Seizures are a common neurological manifestation in cats, with an estimated 1-year prevalence of 0.2% in primary care veterinary practices in the UK and 3.5% in the referral hospital population in Austria. MRI and cerebrospinal fluid analysis are often used in the diagnostic approach for cats with epileptic seizures. Previous studies in dogs have shown that performing CSF analysis in those with suspected idiopathic epilepsy and unremarkable MRI rarely reveals significant abnormalities. To our knowledge, there has been no similar study evaluating the diagnostic value of CSF analysis in epileptic cats with unremarkable brain MRI. This retrospective study aimed to identify how often epileptic cats with unremarkable MRI scans or just hippocampal signal changes have abnormalities on CSF analysis. Materials and methods. Patients, brain MRI and CSF data of feline epilepsy patients presented to the Small Animal Internal Department or the Diagnostic Imaging Department of Vet Meduni, Vienna, Austria, between June 2011 and December 2017, were reviewed. The following inclusion criteria were used for patient database research and all were mandatory for study selection. Brain MRI was performed because of a history of recurrent seizures. MRI of the brain was unremarkable or only hippocampal signal changes were detected, and CSF analysis was performed. Recorded basic patient information included age, sex, neuter status, CSF total nucleated cell count, CSF red blood cell count, CSF total protein, CSF cytology, and the result of the histopathological examination. Based on the client's descriptions of seizures and presentations, the cats were classified as having focal epileptic seizures only, focal and secondary generalized seizures only or an unknown type of seizure, orofacial seizures or focal seizures, and were not specifically evaluated. Every cat in the study had minimal basic blood analysis, including hematology and biochemistry with glucose, creatinine, urea, TP, albumin, alkaline phosphatase, alanine aminotransferase, and electrolytes. In most of the cases, aspartate aminotransferase, glutamate dehydrogenase, creatine kinase, cholinesterase, and bile acid were also measured. These data were not specifically collected or evaluated. MRI scan interpretation. MRI was performed with a 1.5 Tesla MRI scanner with the cat's in ventral recumbency under general anesthesia. The MRI protocol used initially included 3 sequences, which were completed during the study following the MRI protocol provided in Table 1. Slice thickness varied only slightly with body weight. For the contrast series, 86/87 cats received contrast agent. The MRI criterion for hippocampal changes was the subjective D2 and flare hyperintensity elevations of the hippocampi compared with the gray matter of the adjacent temporal lobe or pathological contrast uptake of the hippocampi. Included MRI studies were initially evaluated by several radiologists in the department and re-evaluated by a second-year radiology resident according to the following criteria: subjective evaluation of the hippocampi and detection of other brain lesions besides hippocampal changes. CSF analysis. CSF was collected from the cerebellomedullary cistern following MRI study under the same anesthesia. Samples were collected in a plain tube and examined immediately at the central laboratory of the Vet Meduni, Vienna, or by a board-certified neurologist/senior neurologist at the clinic. Both neurologists use the same CSF analysis technique. TNCC was evaluated with the Fuchs-Rosenthal counting chamber using Samson solution. A CSF cytological cytospin evaluation was performed if the TNCC showed 5 cells. TP was measured using a Cobas C501 analyzer with the Biarrit calorimetric method. RBC count was evaluated using a Cumber 9 test HC strip with the following possible results: plus, and plus. Pleocytosis was defined using our laboratory's reference intervals, TNCC, 5 cells and TP, 480 mg per liter without severe blood contamination. Cats with increased TNCC and severe blood contamination were excluded from the study due to the inability to objectively evaluate the elevated cell count. Statistical analysis. Data were recorded in a Microsoft Excel spreadsheet. The descriptive statistical analysis was performed by the first author. Descriptive statistics included measures of frequency, measures of central tendency, and measures of dispersion. Results. 90 cats met the initial inclusion criteria. 3 cats with increased TNCC and severe blood contamination were excluded from the study. A total of 87 cats were included in the final study cohort. 70 cats had unremarkable MRI, 5 had hippocampal signal changes with contrast enhancement and 12 had hippocampal signal changes without contrast enhancement. 7 of the cats were female, 41 of which were neutered and 6 entire. 40 cats were male, 37 of which were neutered and 3 entire. Age at presentation to the clinic ranged from 3 to 161 months. Exact age of presentation was unavailable in 3 cats. 24 cats were presented with focal seizures only, 17 cats had a history of focal and secondary generalized seizures, 43 cats had generalized seizures only, and in 3 cats the type of seizure was unknown. CSF analysis was performed at the central laboratory in 77 cases, while 10 cats were evaluated at the clinic. Median TNCC was 0.6 cells. Median TP concentration was 109 milligrams per liter. 6 cats were excluded from the statistical analysis of TP because there was not enough material for testing in 4 cats, or due to negative results using a Cumber 9 test HC strip at the clinic in 2. The CSF was contaminated with blood in 65 cases. From these samples, 25 were contaminated. Data on blood contamination were unavailable for 4 cats. TNCC was increased in 4 cats. Of these, 3 had only a borderline increase in TNCC, and 1 had mildly increased TNCC. The 4 cats with mild pleocytosis were not tested for leucine-rich glioma inactivated 1 antibodies. TP was within the RI for all cats evaluated for TP. In 4 cats, the TP evaluation was not available. All cats with pleocytosis had an epileptic seizure within the 72H before CSF collection. More information on cats with CSF changes is provided in Table 2. Histopathology was performed on 11 cats. Of cats with CSF pleocytosis, only 1 underwent a necropsy and was diagnosed with meningitis of unknown origin. Of the remaining cats with no CSF changes, hippocampal necrosis was confirmed in 2 cases, as well as hippocampal sclerosis in 2 cases. Other diagnoses included another meningitis of unknown origin, lysosomal storage disease, encephalitis and non-suppurated leptomeningitis. There were no changes in the brains of 2 cats. 10 of 11 cats had unremarkable MRI, and 1 cat had hippocampal signal changes with contrast enhancement. Discussion. We aim to investigate whether it is of value to perform CSF analysis in cats that do not have structural brain changes on MRI. CSF taps are associated with risks, including iatrogenic brainstem injury and subarachnoid hemorrhage. The requirement of experienced personnel, prolonged anesthesia duration and increased costs could also be considered in the diagnostic approach. Performing CSF analysis in humans is not recommended in epilepsy investigations unless signalement or history and clinical signs are suggestive of infectious causes currently. CSF analysis in dogs is required as a part of the Tier 2 criteria for diagnosing idiopathic epilepsy by the International Veterinary Epilepsy Task Force with the goal of excluding inflammatory disease and/or infections as yet. There is no consensus on the diagnostic approach for epilepsy in cats. In favor of the fact that a CSF tap can be helpful in patients with a normal MRI, it has been reported that 7% of dogs with a normal MRI had meningoencephalitis of unknown origin also. In a study that evaluated the MRI findings in 14 cats with meningoencephalitis, 4 did not show MRI changes. The remaining cats were diagnosed with feline infectious peritonitis and histiocytic encephalitis. Similarly, in a study that evaluated the MRI features of lymphoma involving the nervous system in cats, intracranial MRI lesions were present in 22/31 cats. In this study, CSF analysis was abnormal in 20 out of 25 cats, although the CSF cytology was in the diagnostic range for lymphoma in only 5 cats. It is worth mentioning that MRI is not 100% sensitive or specific, although a sensitivity of up to 94.4% and a specificity of up to 95.5% for detecting brain abnormalities in dogs have been reported. It seems likely that these numbers in cats are lower due to their smaller brain size. Only a few systemic studies have evaluated CSF in dogs with unremarkable MRI findings, and, to our knowledge, no studies have evaluated the same in cats. In a previous study, mild abnormalities on CSF analysis were identified in 10.6% of dogs with suspected idiopathic epilepsy and a normal MRI. These results are also in agreement with another study, where only negligible abnormalities on CSF were found in 15% of dogs with suspected idiopathic epilepsy and a normal MRI. The findings did not lead to a change in the diagnosis or management of these cases. MRI signal changes in the hippocampal region of cats are frequently consistent with hippocampal necrosis on histopathology. They may also be caused by other pathologies, including hippocampal sclerosis, edema, inflammation, ischemia, or a combination of these. Moreover, epileptic seizures may cause an altered MRI signal postictally, but documented feline cases are rare in cats with postictal MRI changes. CSF analysis results are expected to be unremarkable or show only very mild postictal pleocytosis. Cats with solely hippocampal MRI signal changes are an important proportion of feline epileptic patients, but this is also a problematic group. This originates from the cause or consequence problem, as the seizure itself may cause a hippocampal pathology. The International League Against Epilepsy has not determined whether hippocampal sclerosis is a non-specific result of primary epileptogenic lesions, or if it is coexistent. The issue is controversial, and both possibilities are likely to be partially true. Therefore, we decided to include this group, as such cats with seizures do not have clear structural etiological changes in the brain. These cats may be included in the group of idiopathic epilepsy with suspected postictal changes. However, the absence of neurological signs postictally is an important requirement for this diagnosis. Some authors prefer to use epilepsy of unknown origin instead of idiopathic epilepsy, as a genetic etiology cannot be confirmed in cats, and the use of this term is also more appropriate for this group. In our study, 1 histopathological examination was performed on a cat with hippocampal signal changes. The result confirmed hippocampal necrosis. CSF pleocytosis was found in 4.6% of all cats. TNCC was only borderline increased in 3-4 cases with suspected idiopathic epilepsy as a final diagnosis. This corresponds with the SD of the normal distribution curve for RIs. Only one cat had mild pleocytosis, with a history of lymphoma. CNS involvement was suspected but not confirmed. The pathological examination of this cat revealed meningitis of unknown origin. All cats with abnormal CSF results had an epileptic seizure within 72 hours before CSF collection. Postictal pleocytosis has been reported in human medicine with a prevalence rate of 6 to 34% in patients with epileptic seizures without evidence of infectious or inflammatory causes. One suggested mechanism for an increase in TNCC on CSF analysis, associated with recent seizure activity, is a transient disruption to the blood-brain barrier. Studies on dogs have provided various results. One study reported an association between the CSF TNCC and seizures, with the TNCC tending to decrease with increasing length of time between the last epileptic seizure and CSF collection. However, this association was not found in all studies. Although no correlation analysis between CSF changes and the time of last seizure was found in our study, it is a logical assumption that mild postictal pleocytosis also exists in cats. A high percentage of our samples showed some degree of blood contamination. We cannot compare this with previous studies, because the percentage of contaminated samples was not mentioned in these other studies. CSF contamination is most commonly iatrogenic, and the literature is conflicting about the impact of blood on the CSF analysis. The correction formulas to help estimate these effects on CSF cellularity have also been published. With inconsistent agreement, we decided to exclude cats with severe blood contamination and CSF pleocytosis from the study, to avoid misinterpretation of the results. The limitations of this study include the fact that the diagnosis of idiopathic epilepsy could not be confirmed and subclinical disease-causing epileptic seizures could not be excluded. Because of its retrospective character, data on prior treatment and pre-interictal clinical and neurological examination were mostly unavailable. Excluding such cases would considerably reduce the number of included cats. We also did not evaluate the laboratory results or results of other diagnostic imaging, and we did not include follow-up and outcome data in all cases. Histopathology was only available in 11 cats. In these cases, considerable time had passed between MRI and histopathology, which makes a firm conclusion difficult. Conclusions. In a cohort of cats with a history of seizures and unremarkable MRI or hippocampal signal changes only, CSF changes are rare, and the sporadic borderline pleocytosis does not change the diagnosis or management of these patients. However, CSF analysis is generally an important diagnostic test for CNS disorders, so the diagnostic benefit and risks should always be considered in individual cases.
Overall, this is a fairly short and straightforward article. It starts by discussing the prevalence of epilepsy in cats, which is largely unknown, but likely less than that of dogs. Additionally, we know that in dogs with idiopathic epilepsy, CSF is generally normal in the face of a normal MRI, but it is unknown if this is the case in cats, so the goal of this study was to find if CSF is normal in cats with epilepsy that have a normal MRI, or an MRI with changes only in the hippocampus. After going through the article and listening to the discussion, they do a good job reminding us of studies published in cats with seizures, which are few and far between. Reference 13 is a good reminder that MRI can be normal in cats with meningoencephalitis, but the utility of CSF was not evaluated in that paper. The same can be said for lymphoma in cats, which is reference 14. They also do a good job summarizing where we are at with hippocampal changes in cats with seizures, calling these cats a problematic group. This originates from the cause or consequence problem, as the seizure itself may cause a hippocampal pathology. Regardless, they included this subset of cats in this paper, and it does not seem to be considered structural epilepsy in at least a subset of cats, and I feel this paper is stronger overall for doing that. They do a good job listing out the limitations of this study, and I feel a big one that they highlight is that histopathology was done a considerable amount of time had passed between MRI and histopathology, so it makes a firm conclusion difficult. All that said, I think there's valuable information to take from this study. Firstly, CSF seems to rarely add additional information in the face of a normal MRI. More importantly, however, is that a normal MRI could easily miss significant disease. Both of these points are not anything new. However, this study does do a good job highlighting this, or at least these points. I do wish there was more follow-up information. For me, some of these cats with hippocampal changes have a poor prognosis with unrelenting seizures, so it would have been interesting to see if the degree of enhancement, for example, correlated with overall prognosis. But from my clinical experience, I would say that there doesn't seem to be that correlation, because some of the cats can do well despite pretty marked enhancement. Overall, from my clinical experience, I do agree with the findings of this paper. That said, I still typically will acquire CSF on cats with a normal MRI that have seizures, and this paper did not change that for me, and this is largely due to convenience, as cats have to be anesthetized for us to do an AO collection. That's all I have about this paper. I thought it was well done, and thank you.